Hi, everybody. Judy is right. It is an absolutely gorgeous fall day, and I'm so happy you're all here with us. This, of course, this is a real meat and potatoes geriatrics topic, balancing independence and aging. We talk about this almost every time that we see our patients. You know, the hovering kids, people telling you what you can and you can't do. When you want to jump out of an airplane at the age of 80, like George Bush, or you want to put your pedal to the metal, or you simply want to stay in your house and not have people butcher you all the time. So these are, or what independence means to you, right? It might mean from getting to your chair to the kitchen table. So we know that this is a really, really important topic for you and your families and your care partners. And we're so delighted that you've joined us. So I'm going to pass this on to Susan Edgman-Levitan, who you know well, and she's just gonna set the table for you guys.
All right, thank you, Dr. Levine. I want to add my welcome to everyone. It's wonderful to see you. And my name is Susan Edgman-Levitan, and I'm the Executive Director of the Stokel Center for Primary Care Innovation at Mass General. So before we get started, I want to just go over a few housekeeping rules. First of all, everyone but our speakers is muted because we really want to eliminate any background noise that would make it challenging for us to hear our speakers. If you want to view this person speaking on your full screen, you can go to the upper right-hand corner and you can either click on speaker view or gallery view, which lets you look at all of us as well as the speaker on the screen. And it's in your upper right-hand corner. If your picture becomes jumpy or gets fuzzy, click stop video in the lower left-hand corner where you see the little video camera. You will go off screen, but it will probably make your picture in general better and will speed up your connection. We really want everyone to join in the discussion that we'll get to later in today's town hall. So please use the chat feature that's right in the center of the bottom ribbon across the bottom of your screen. And also, I know you all know this, but please don't share any personal medical questions on the chat because everyone on today's town hall can see anything that's written in the chat. So we don't think you want to share your personal medical information with all of us. But if you do have important medical questions, please reach out to your doctor. We'll try to answer everybody's questions, and I think we'll probably have enough time today to do that. So let's get started. We're very fortunate today to have Dr. Cornelia Cremens as our main presenter. And Dr. Cremens is the geriatric psychiatrist at Mass General and has been there for over 30 years. She completed her training in psychiatry at Mass General Hospital and geriatric medicine at the Harvard Medical School. She's the former co-chair of the Mass General Hospital Ethics Committee, and she continues her active participation in geriatric psychiatry and with the Optimum Care, which is our ethics committee at MGH. And you're also going to hear from Dr. Matt Russell, who is the medical director for geriatric medicine and the ambulatory care director for the division of geriatric medicine. So with that, I'm going to turn this over to Dr. Cremens. And I apologize.
And I'm delighted to be here. I'm going to share my screen so that I can figure out how to do that now. Did you all tell me how to do it? Yes, you did. Okay, again, I'm having problems sharing my screen.
Thing that's with an arrow that goes up and it's usually next to the chat.
Okay.
Click on it.
I got it.
Okay.
Is that it? Can you see me and my screen?
Perfect.
And I have a little something over here that I probably don't need, right?
Put on presentation view.
If you can go to the bottom and click on the little video camera, that will make your
There you go.
slide.
Not the video camera, the little.
Not the video
Right.
camera, the screen.
Okay,
The thing that looks like a pedestal. There you
Right
go.
there.
got it. Oh, I'm still learning. It's amazing, isn't it?
There you
At
go.
my age, I can still learn. So I have been asked to talk a little bit about independence as one ages, and it's a complicated topic, certainly. And can you all see this? Is this too large, or everybody's okay with this, huh? So, okay,
It's perfect, Cornelia.
Yeah,
You
thank
look
you.
great.
So what we know is certainly from statistics is that older adults are growing in number dramatically. And between 2010 and 2050, the number of adults, I can't even see my own screen here, increased. And I have to go back again. I am so sorry that I'm so challenged here today. I've had a very busy day. There we go, previous. There we go, previous. And it's expected that more than double the number of, I'm really sorry to be so challenged, but can somebody show me how I turn off this and just have slides? No, oh, I got it now, there we go. So between 2010 and 2050, the number of US adults over 65 is expected to more than double, reaching 8.5 million, which is amazing. And this is the first time that seniors have outnumbered the younger population. So we have a lot of seniors and not so many younger people who often are the caregivers of older patients when they are no longer independent, but we're going to talk about independence. And with this large increase, Americans will require an increase in housing and facilities that care for older adults. And I think we're already challenged with that, and an increase in demand in social services and human services. And also these services will play a vital role in helping adults maintain their independence. So this is just a slide from the US Census that shows a visual picture of what we're looking for going forward. And here in the United States, this has never happened before. It has happened in other countries, but not in the United States. So I'm usually
I think you can just hit your down arrow on your laptop and it will
Thank
change
you.
the slides for you. Go ahead.
So we all and everybody here certainly values independence, and health and well-being really are the single most factor in helping us maintain our independence. And remaining independent can have benefits for health and happiness. Certainly, the more independent you are, usually it is the more healthy you are and the more healthy you can continue to be. And also it's certainly is a very bright day when you can go off and do your own thing and not be dependent on anybody else. Physical illness, though, is probably the most significant impact on reducing our ability to be independent, and especially injury. It can definitely change the ability to remain independent in the community. And both medical and degenerative aspects of aging are hard to prevent. But accidents are really the key to reducing our independence, certainly. And I say our independence because I think of it as where I am going as well. And the accidents usually are not paying attention, having, when we'll go through this later, and they do really prevent us from maintaining our independence, and especially hip fractures. Sorry, I just pressed that button. They're the most lethal, certainly. People have difficulty walking. They are in bed for a long period of time, although now our orthopedic surgeons try and get our patients out the day of surgery so that we don't have so much of an issue. So how can we prevent that? You probably know this because our geriatricians use this all the time. The 4 M's in assessing people. And number 1 is what matters. And for us, what matters to us most? What matters to us most is that we can remain independent, that we can take care of ourselves, that we can remain in our home, and all of those. Certainly, when that changes, we talk about what matters now and where we would like to go and what we'd like to do. And certainly the medications that we take. I have had patients come to my office that have no medicines. I'm always shocked when somebody says no medicines. And then I have to sort of say, well, do you take any vitamin pills? And maybe they do take vitamin pills, but it's unusual that older patients aren't on at least 1 or 2 medicines. And mentation certainly is important. You know, how are you thinking? Psychiatrists talk about this all the time, and we all think about this all the time, because medications certainly can do that. Not paying attention, not exercising, not eating well, all of those things can affect mentation, as well as genetics. You know, with a genetic history of somebody who has difficulty thinking, has a diagnosis of some dementia, certainly is an issue. And then, as I said, with mobility, I personally, and I know you all, want to be able to get around. We want to be as mobile as possible. And doing that certainly requires a lot of energy and a lot of coaching. So the single most frequent accident certainly is falling. And the simple safety measures, if you're in your own home or even in an assisted living, is to make sure that you don't have a rug that you can trip over. Very, very easy to trip over a rug, and very easy to make a misstep, and falling certainly leads to a fracture of some sort. If you're out walking, you know, those roots that kind of come up in the middle of the trail, those are very dangerous. You trip on one of those, usually you go flat down and can fracture a shoulder or a hip. So always paying attention, watching what's under your feet is really important. And handrails in the bathrooms and on stairs. I like the handrails in the bathroom, you know, even for people who have no impairment or no physical problems at all. I just think it's convenient to have that and preventive. And certainly on stairs, coming down the stairs, very important to be very, very cognizant of that. And important to repair any steps that have any problems, any uneven floors, surfaces. And I also suggest and educate people in the use of a cane or walker if there's anything that's unsteady, preventing that and being cognizant of, if you are having difficulty walking, will prevent a fall, certainly. And the smoke alarms and fire alarms in homes are important. What's really important, and I sometimes fail to do this myself, is to make sure that they're up to date, make sure that you have batteries and things like that, because we've recently had a patient admitted to the hospital who had a fire and the fire alarm didn't go off. So that certainly does impact your life. And the medications, really maintain that you're taking them every day, have a spot where you leave them, be organized, try not to run out, all of those things, so that you don't cause any impairment. And stove and cooking are really important. I think I enjoy cooking. A lot of people enjoy not cooking, and to have meals delivered is really wonderful, but you oftentimes are trying to heat up those meals that are delivered. So cooking is another dangerous spot to be in, and certainly a risk for a burn and a significant hospitalization and injury. And then family and friends, I always say that this can be the most challenging part, because somebody thinks that you're older, you may be 92 or 93, and that you need help when you really don't need help. And that battle and challenge is always concerning to me, because I think when people try to push you to move from your home to someplace else because they think there's going to be a problem, it's really important to challenge it and to talk about it and to really be sure that that's what you want to do. I see several patients who I suggest that that's what they do, because I see something in the offing and do not want that to be a problem in the future. And it can be challenging as well with the family dynamics, that if one member of a couple needs to go to for assistance and the other does not, that becomes challenging as to who is going to either split up or stay behind. But it's very important in maintaining your independence to make those decisions and to talk about those decisions over time, so it's not something that you're challenged with at the moment of need. And then always questioning somebody's judgment. I don't care how old you are, people are always questioning your judgment. When you were a child, I'm sure your parents questioned your judgment about whether or not, riding in the street was safe, if you didn't have a helmet, all those kinds of things. But for some reason with older patients, questioning their judgment, unless there is a significant impairment, unless there's something that has been deemed to be impairing their judgment, it's, I think, good to allow people to have that certain independence and ability to speak for themselves. And if a patient is comfortable in their own home, families sometimes encourage them to move because it's a big house. There are, 4 extra bedrooms and nobody's there, and maybe it's lonely because there's nobody there. One of my patients, when her children moved out, she had some students from a local college move in, and she said it was very comfortable and very happy for her. But I think when you're planning to move, it's a big decision and it really needs a lot of discussion and needs to be done early on. And when you have friends who have been in your neighborhood for years and they have moved, that can certainly impact your happiness being there with your friends having moved. So when I was out at Fox Hill Village at a time, there were whole groups of people who moved in together. They all sort of planned this move so that they could have that there. And being in a facility, either a care facility or an independent or assisted living, really does provide for a lot of socialization. And sometimes people complain about too much socialization, but you can choose to participate or not. And I think it's important to maintain connections in your home, connections in your neighborhood. Keep all those friends that you've known for years informed of what you're doing. But once you have difficulty with numerous tasks at home, it becomes more challenging. I think lots of people have somebody who comes in to clean once a week. That might not be enough. Once a month might be too little. But to be challenged with having to do a lot of caring is can put you at risk too. And and then I think the decisions, the options, and the directions you want to go should really be well planned out. I talk about this all the time in my own family. I'm not sure I did such a great job with that, but when it's your family, it's difficult. So certainly to seek assistance and to find people who can help you make those decisions and to have those options and to have that early on so that you're not in the last minute scrambling to find something. So what do you identify as young or old, which has always been an interesting topic for me. If you have like Mr. Kelly, who ran the Boston Marathon for many, many years, he was an older man and he was exercising every day and did well. You identify him as young or old. Well, he was kind of frail, he was kind of wrinkled, he did look old, but he certainly had a lot of energy. I think what you want to do is look at yourself and say, who am I? What am I doing? Do I want to do a marathon? Do I want to continue what I'm doing? Am I old? Am I too old to do some of the things? And to look at that not only within yourself, but also discuss it with caregivers and family and certainly your physicians. And then identifying as young or old, do we find we fall into categories as well? So if you get Medicare at 65, am I old now? Does that make me old? If you're still working, I must be younger than people my age if I'm still working. or if you're injured, ill, or you have memory loss, then I think memory loss significantly sort of puts you in the category of older and not thinking well. There are 90-year-olds who live independently. I have a neighbor who's 95 last week, and she lives alone with her cat, Foster. And there are many people, so I think age is not a determining factor if you are going to continue to live in your home or not. And conflict about this can arise in any family. It's hard to watch somebody struggle, but yet their struggle really keeps them active as well. So it's an important conflict to have at sometimes, and that families really are caring and concerned. And sometimes, as with my neighbor, you know, all of her children live far away. So the neighborhood kind of gets together if she needs help with anything. So I think, you know, trying to decide whether you want to stay in your home or move someplace where there is assistance is a challenge. And then the identity of us older adults, because I put myself in that category as well, is that, do I feel older or younger than my age? Well, some days I feel older than my age, and some days I feel younger than my age. But I think that we do have to really identify what's going on. I know that I need to exercise more. I feel better when I exercise more. Do other people consider me old? Possibly. And what does my family say? That I'm too old, I'm elderly, I'm aged? To know what their thoughts are. I do think that I'm relatively healthy, active, robust might be overstating it, but I think the more you do and the more you interact, the better functioning you're going to have. And then questioning the focus on age versus ability. And I don't think that those two are equal. Depression, very, very significant. This is what I work with all the time. At times it can be very subtle and it does cause impairments. It results in a loss of independence. It's treatable, but a lot of patients, older patients, feel that there's a stigma to a diagnosis of depression or dementia. It limits treatment when somebody does not want to take a medication, or if they're not treated adequately, and it really impairs their ability to return to independence. And once caregiving is established, improvement may be noted, but there are many avenues to this recovery from depression. Medications are very helpful, but there are many other approaches to treating depression. But the important thing is to treat it and to treat it completely, because it does cause an impact on independence. And delirium is usually time limited. Oftentimes it coincides with a medical illness that you've had, causes a lot of confusion. However, families often view this as a time to consider transition to a nursing home and limit your independence, where recovery from delirium can be quite successful and you can return to live independently, but it's always a struggle, and especially with family. Clearly a very serious diagnosis, but patients can recover from delirium and return to independent living. Families burdened by recovery from an illness and the hospitalization and operation, serious injury, are quick to move to have more assistance in the home or move to a place where that is provided. Loneliness I struggle with oftentimes because, often noted after the death of a spouse or a friend or colleague, somebody that you talk to every day, somebody that you lived with. And some adults have lived alone for a long time, lived independently, lifestyle most of their lives, and you have a few friends, but live alone and aren't lonely. Less activity can lead to further isolation and further loneliness. It's not talked about as yet, but the benefits of, I will talk about it later, the benefits of exercise for older adults is really important. And that also puts you in a community oftentimes of other people, even if you're just out walking. But certainly loneliness can contribute to isolation, loss of connectivity with others, and also lack of stimulation, which does impact dependency. Exercise increases strength, and often just walking is beneficial. I see so many people out walking all the time. If you can be with others too, scheduled walks or just meeting the same person around the same time when you're out walking is also very important and very helpful. So how do you improve your life? Healthy behaviors throughout life lead to sort of improved end of life and improved to older adults. But improving physical and mental capacity will delay this care dependency and loss or reduce of independence. A balanced diet, eating a really good diet. As we get older and the family's not around, sometimes we don't prepare a meal as best we should, but that's a very important thing to do. And regular exercise, either walking, yoga, weight training, stretching, any of those regular things that you like to do, and meditation included with that, really helps. The regular exercise really helps maintain your independence. Obviously not smoking tobacco, and if you do have alcohol, to limit the amount of alcohol that you have, or maybe not drink if it's not important to you. And then engage in activities that bring you joy. Do you like reading? Do you like, I guess not many people have been going to the movies lately, but do you like watching movies? There's lots of entertainment in Boston, certainly going out to the symphony, out to concerts, to the Boston Common has all sorts of activities. And to challenge yourself intellectually. The more you challenge yourself, the better off you're going to be. So activities to recharge and maintain independence: exercise, choose what you can do, choose what you can do comfortably and also regularly. And meditation may be very beneficial for mood and memory, and I recommend it for majority of my patients. I think that meditation is very helpful. And time alone, reading, crafts, things like that, it's also an important aspect. But to schedule times with friends so that you are communing and getting together and really doing more in communication, I think is important. And also games that challenge cognition. I know there's a new game out called Wordle. I don't know if anybody's in on that, but it's how you figure out what the word of the day is. But, Scrabble, games, any type of thing that's going to challenge you to think. My friend's 94-year-old grandmother used to beat us in Scrabble all the time. It's embarrassing, but they do that, So there's no typical older person. I can't say that this is an elderly man, this is an elderly woman. Some 80-year-olds have physical and mental capacities like 30-year-olds. Some 90-year-olds are clearer and more coherent than I am at times if I've had a busy day. And other people experience significant declines in capacities at much younger ages. So you don't have to be old to have a significant decline. And a wider, more comprehensive public health response must address the range of older adults' experiences and needs. And certainly there are some Midwestern communities that are doing much more about independent housing and things like that, where you have the ability to do that, which I think is very important. So thank you for allowing me to participate. Thank you all for participating. My goals are to tell you to continue to exercise, eat well, stimulate your mind with reading, games, and meditation, and stay healthy. Thank you.
Thank you. That was a wonderful overview and a lot for us to think about. I'm going to ask you to stop sharing your screen, and we're going to go to Dr. Russell.
Okay.
So the bottom of where it was share screen, now it should say stop share.
It should say stop share. It says it at the top, actually.
Oh, it's at the top. Click that.
Stop share. Thank you.
There you go.
Great.
Excellent. Great. Thank you, Cornelia, and thank Dr. Cremens, and thank you, Susan. So happy, beautiful pre-autumnal day. My component of this afternoon's presentation is speaking about independence and driving and transportation. Just as a little background, for many of us who are in this, in geriatrics, this is a very challenging conversation to navigate between us and our patients, and always between our patients and their families. And there are a couple of principles that I want to ground us in as we kind of share how we think about this as the medical profession. So the first principle is the illusion of safety versus the dignity of risk. When people want you to stop driving, it can be for very good reasons, but sometimes it can be infantilizing unnecessarily. And the originating emotion for that is not usually to control my loved one, but to protect my loved one. But this is that same thing that when you let your kid get on the bus the first time, or you let your kid behind the wheel the first time. We can't wrap our loved ones in bubble wrap, no matter how much we think that might help. So when we talk about the illusion of safety, sometimes families will say, oh, let's move mom to an assisted living where she'll have more supports if she needs it. But meanwhile, we're disrupting mom's entire social life, her faith community, and her friends and neighbors where she's lived for years, and you're plonking her down in a place where she doesn't know anyone. And what are the harms that could happen with that? So engaging in a discussion with our patients and their families around, are we talking about a real concern, or are we talking about the illusion of safety? Similarly, on the other hand, when we talk about the dignity of risk, even though I might not feel comfortable with my mom doing X, Y, or Z, she is an adult who is cognitively intact, has every right to do her own risk-benefit analysis and say, here's why I'm willing to do this. The main upshot is obviously to keep the lines of communication open and not to get pitched battle with one another, so that really it just becomes someone being the enforcer and someone being the oppressed. Now, just to speak specifically about driving, as we all know, we are an aging population, and by 2030, less than 10 years from now, there will be 70 million people age 65 and over. Of that, 85 to 90% of those individuals are licensed to drive. Now, who thinks senior drivers are less safe than, say, the general population? Raise your hand if you think that.
Being an older driver, Matt.
Being an older driver, yes. Who thinks they're actually more safe? And the data pan out that they're actually more safe. They wear their seatbelts, they don't drink and drive, and they observe the speed limits and the cautions. Now, that being said, when folks are in accidents and they happen to be older, they have a very high likelihood of serious and fatal injury. So it's very important to understand that even though we might be, cautious, if we get into an accident, it has much deeper health implications than if I were 22 years old. So a little sobering fact is that senior drivers do have the highest crash death rate per mile driven, with the exception of teenagers. Now, when folks are starting to hear murmurs in the peanut gallery about their driving, it's a very fraught conversation. And as Dr. Levine and I can attest, it is the hardest conversation to host in the clinical space. It's easier to talk about death and dying and deliver bad news than it is to deliver the specific bad news that driving is no longer a good idea. And when we think about the conversation, the elements of what people have said to us, when this has been raised by either a spouse or a concerned family member, or sometimes from a local police agency, those accidents weren't my fault. I'm a safe driver, and I would never drive if I thought I might hurt someone. I hear that one the most. I would never drive if I thought I might hurt someone. Who gets behind the wheel of their car to hurt someone? No one sets out to do that. That's why they're called accidents. I only drive on familiar roads and never at night. My family is ganging up on me. Again, this is that part where we have to suss out, is this truly a concern, or is this just an overly protective family member wanting to preserve the person they love in bubble wrap? I have a perfect driving record. I've never gotten into an accident. I've never gotten a citation. Why are you bringing this up? Past performance has clearly said I am a safe driver. I only got lost because they changed the road signs. And then the last one, and this is actually, I think, really important as Americans. Driving is my freedom. I would be homebound if I didn't drive. Now, when we think about the 20th century and the place of the private motor vehicle in the 20th century, the Eisenhower interstate system, the growth of suburbs, the shopping malls, it is in our blood, almost our DNA, how important the automobile is. In other countries, not quite the same love of cars. I mean, you go over to Europe, no one's really trying to own the fanciest car in a congested European city. They're riding their bicycle or taking public transportation. Maybe if they're in Germany and they're lucky to be on the Autobahn, it's a separate matter. But here in the United States, we're a very car-centric world. You can't get anywhere unless you're on four wheels. So how do we balance that whole identity with the fact that for many reasons, people have to stop driving, and challenge the assumptions that people might make that I might be homebound if I couldn't drive? So there are plenty of reasons why this is a fraught conversation, why it's a very challenging conversation. When do you think, how do you know if you're a good driver or not? That's one of the questions. Like, I think I'm okay. Yeah, sure, I'm 82, but I've never gotten into an accident. No one said anything. I don't really know that I have a problem. If you feel concerned about your driving, that your skills have diminished, or that you've restricted what you're doing, that might be a sign that says maybe I should have someone assess me. Other folks have said informal things to you, things in passing. Obviously, if you have been diagnosed with a medical condition that could impair your ability to safely operate a vehicle, so poor vision, low vision, dementia, sometimes, well, always seizure disorder, sleep disorders, and strokes. If I can't move my left side or I have visual impairment, that because of a stroke, that will make it more challenging for me to safely navigate the roads. And for those of you who are near Boston, even on the best day with heightened, radar and whatever other things we could use, you feel like you're a sitting target for some other heat-seeking car. It's a very intense driving situation. It's like advanced placement driving to get into Boston. If you've experienced a recent increase in near misses or minor crashes, fender benders, things where you're bumping the car, nicks and scrapes. And then if people have said, even lovingly, you know what, I'm a little worried about you driving. Those are all indications that let's get you assessed. Let's figure out, are you actually an impaired driver? Is this actually something that we need to help you with? So what we typically will say in situations where there's a gray zone, where it's a person who is quite functional, maybe that person has, a stiff neck, and the daughters are worried about their ability to look up and down the road. Let's get an assessment done. Let's do an assessment. So there are clinical driving assessments that can be done. Usually that's done by an occupational therapist who will do both an in-person sort of classroom-based assessment or office-based assessment on medications, your functional ability, reflex time, etc. And then they'll also do another part, which is a functional on-the-road assessment. And that includes limited, checking for adherence to traffic rules, regulations, consistent use of strategies to compensate for any visual, cognitive, physical, and behavioral impairments. And then they can make recommendations. If it's something that could be modified and optimized, they can make recommendations. Now, sometimes it comes to pass that a patient might go for one of these assessments and have a recommendation. Just, I don't think it's a good idea. I don't think it's a good idea for you to continue driving. There's a grief, obviously, that would be associated that we have to associate with that, and we have to reframe what our independence looks like. And so for those of you who've heard me say this before, when you start out as an adult, you're a rowboat. You're the ship and you're the oars, and you're moving things around and you're steering. As we get older and we accumulate impairments, medical syndromes, additional medications, we become a cruise ship. And you are still the captain, but you need a staff. And so if you're not the one who's at the helm driving the ship, who's going to be, and how can you still manage to be independent through that? Now, I'm going to rapidly scan through, but if you would like to raise your hand, if I ask this question, how many of you are able to use Uber or Lyft? Just raise your hand so I can see it. Okay. All right, so I see some folks are able to do it. So that's certainly a riding app that will come to you and bring you to your chosen destination at your timeline, at your convenience. It is certainly another level of freedom that we didn't have 10 to 15 years ago, where you'd have to call a cab to get to the airport and you might be waiting 25, 30 minutes. This car comes in 5 minutes. But some people don't feel comfortable using a smartphone or don't have a smartphone. And there are options for you to join Uber or Lyft and be able to call a number to have an Uber or Lyft come to your house and drive you back and forth. So all you need is your cell phone to complete the round trip. And that actual website is called gogograndparent.com. Yeah, we don't like the name. We wish they'd kind of change the name, but at least it gets us to the place where you just call and say, hi, and they'll recognize you from your phone number. Where do you want to go? You give them the address, and then you do the same thing when you want to complete your round trip. As an example, my uncle, he never drove a day in his life. He had an impairment of vision in his left eye. One year he said, I want you to give me a cell phone so I can use Uber or Lyft, because he was relying on the nephews and his brother to kind of get him around. He started using it and he was off he was off, and he said, this is life altering and changing. But sometimes it can be cost prohibitive. The MBTA has the RIDE program. The local aging services access points, also called your councils on agings, they can help with transportation options. If you live in Boston, Age Strong Boston can be a resource. And we're going to give all of these things on our web. Is on our website, Monique, or I can't remember what we said.
Yes, we'll post them to the website when
okay,
we post the recording. Yes.
Excellent. So many people also, the last thing I'll just end with is many people ask about, if I want to have a driving assessment, how does that work? So we'll give you links to some driving assessments. There's one that you can take where it's actually, you take your own online test, which is a question and answer thing that'll tell you if you should have a driving test. And then there are other places that you can go to schedule a driving test to be assessed. Those typically are not covered by insurance, and or if they are, it's partially covered, but the out-of-pocket cost is usually about $225. So with that, I'm going to say that, that the things I want to take away, I'm hoping that you can take away is, yes, we're all aging, and yes, we still want to get around. We love our cars. It may be that I'm fine to drive. It may be that there are concerns. There are ways to suss that out. There are ways to have that conversation with my provider, my physician, and my family. And I am still the captain of my own ship, whether or not I'm at the what is it called? The wheel or
Helm,
not?
helm.
Helm, thank you. I was a landlubber. I never really. I do boats that have Lido decks. Thank you so much.
Dr. Russell, thank you so much. And I can't wait to tell my family I am now a cruise ship. They will love that. And I also want to also just call attention to one thing, and that is Judy Willett's new grandchild that you may be able to see up at the top of your Zoom. So welcome to today's session. And congratulations, Mazel Tov. I also think you all are uncharacteristically quiet today. So we usually have a lot of questions or comments. So I'm just going to pause for a minute and see if anybody would like to add something to the chat. We heard a lot of information today.
I have an interesting fact. I have a daughter who's an urban planner, and she is all about safe streets. That's her specialty. If you drive 20 miles an hour or lower, you'll never kill anybody if you hit them. If you drive 40 miles an hour or faster, you will kill them. And 30 is more risky about hurting somebody. But she said that every transportation agency in every state should have a geriatrician on their serving them, because most accidents actually happen on left turns. So what a lot of towns are doing now is on that left turn, they plant bushes, the sidewalk. So if there's an intersection like this, and you're going to turn left, they will do plantings on that left turn so that people actually see that it's a corner. And there are a lot of other tricks that many streets, many cities are using, and many municipalities. So people are working at this. You know, if you live in California, getting across a boulevard is like you're dead meat. There's no way you can get one of those wide streets in LA. That's not even a meridian strip. So, I mean, there are many things that conspire to make being a pedestrian and making a driver hard in a lot of cities. But people are working on it and they're thinking about it, which I think is very important for you to know.
Thank you, everyone.